it's really kind of wild when you think about just how many people are dealing with chronic kidney disease now,
Yeah.
CKD.
Yeah.
And the numbers are just like massive. Like back in 2017, there were already 843.6 million people dealing with it globally.
Wow.
And that number has probably only gone up since then. And what's really scary is how it can kind of sneak up on you.
Right.
You might not even notice any symptoms until things are pretty bad.
Exactly. That's a really important point to highlight. The National Kidney Foundation defines CKD as any kind of kidney damage that's been going on for more than 3 months.
Hmm.
And it can show up in a bunch of different ways, like problems with the structure of the kidneys or
Right.
the way they're working.
Right.
One way it can manifest is through a drop in your GFR.
GFR.
Yeah, your glomerular filtration rate, which is basically how well your kidneys are filtering your blood.
Gotcha.
And sometimes CKD even shows up as changes in, like, the stuff that's in your blood and urine.
Oh, wow.
It can be pretty sneaky, like you were saying.
For sure. So I guess that leads to the question,
Mm.
are there like other ways to look at this condition?
Mhm.
Maybe through a different lens or something.
Yeah, totally.
And that's exactly what we're going to be diving into today. We're going to be exploring this ancient system of Ayurveda
Okay.
and looking specifically at this concept called Vataj Pandu.
Interesting. Now, I should probably mention that you won't find the term chronic kidney disease in any of the old Ayurvedic texts.
Right. Makes sense.
That modern medical language just didn't exist way back then.
Yeah, yeah.
But what's really fascinating is that there might actually be a connection between CKD and this idea of Vataj Pandu.
Oh,
Yeah, because there are a lot of similarities in the symptoms and causes they describe.
so we're basically trying to look at a modern problem through like the wisdom of the ancients.
Exactly.
I'm into it. We'll also be talking about how Ayurveda looks at the way diseases progress in the body.
Okay.
And specifically this idea of Srotas, which are basically these channels and pathways in the body. So I guess to kick things off, maybe you could tell us a little bit about this Vataj Pandu thing.
Sure. So Vataj Pandu is something that comes up a lot in the classic Ayurvedic texts,
Okay.
which kind of tells you that it was a pretty big deal back in the day.
Right, right. Practitioners were probably seeing it a lot.
Exactly. And it's interesting because you have these different Ayurvedic scholars who each had their own take on what it was all about.
Oh, that's cool. So like what were some of those different perspectives?
Well, you have someone like Acharya Charak who thought that Vataj Pandu was mainly a disease of the Rasavaha Srotas.
That's the Srotas.
Yeah, those are like the channels that nourish your body with this thing called Rasa Dhatu.
Fine.
You can think of it as the most basic fluid that nourishes all your tissues.
Got it.
Then you have Acharya Sushrut, who saw it as a Raktapradosa Vyadi,
Okay.
which basically means it's a disease caused by an imbalance in Rakta Dhatu or blood.
So we're talking about like the really essential stuff here.
Yeah.
Like nourishment and blood. What happens when those get messed up with Vataj Pandu?
Right. Well, they're kind of the foundation of your health, so when they're out of whack, it can lead to some more serious problems, which is what we often see with CKD.
Yeah, that makes sense.
So in Vataj Pandu, when these dhatus are imbalanced, you get a bunch of different symptoms.
What are some of those? Like the key ones?
Well, one of the main ones is called Raktalpata.
Raktalpata.
Yeah. It basically means a lack of blood, which we now know as anemia.
Okay.
Then there's Ojakashaya, which means you're losing your immunity and strength.
Yikes.
You might also see Alpameta, which is basically losing fat tissue or just losing weight without meaning to.
Right.
And then Nisar is a general loss of weight and strength.
Okay.
And then you have Vivarnya, which is when your skin, eyes, nails, and face lose their color.
Oh, so like a paleness.
Exactly. And lastly, there's Shittalendria, which means your senses start to weaken.
Wow, that's a pretty detailed picture.
Yeah.
And it's interesting how some of those symptoms, like the Raktalpata, sound a lot like what we see in modern conditions.
Right.
You mentioned that Pandu is connected to anemia.
Uh-huh.
Can you tell us a little more about that?
Of course. So based on all those symptoms, especially the Raktalpata, it's pretty clear why Ayurvedic scholars connected Pandu to anemia.
Makes sense.
But to really get how it might be related to CKD, we need to look at how Ayurveda understands how diseases work in general.
Okay.
So there are these three main principles in Ayurveda: Dosha, Dushya, and Srotas.
Okay.
So doshas are like these energies that control your body.
Yeah.
You've probably heard of them, Vata, Pitta, and Kapha.
Hmm.
Then you have the Dushas, which are the tissues in your body, like the Rasa and Rakta we were talking about earlier.
Okay.
And lastly, Srotas are the channels that carry the doshas and dushas all over your body.
Gotcha. So, like, how do those three things play into disease?
So basically, when your doshas are imbalanced, it can mess up your dushas and block up the flow in your srotas.
Ah, so that's how disease starts in Ayurveda.
Pretty much. And when we apply this to CKD, we can see how the disease might progress by looking at which srotas are involved at different stages.
Interesting. So walk us through that. Like, how does Ayurveda see CKD progressing?
Okay, so in the early stages of what we call CKD today,
Uh-huh.
which are like stages 1 and 2, where you might not even have any noticeable symptoms,
Right.
Ayurveda says there's an imbalance in the Rasavaha, Raktavaha, and Mamsavaha srotas.
Whoa, those are a mouthful.
Yeah, those are the channels that deal with nourishment, blood, and muscle tissue.
So it starts with those.
Yeah, and this initial disruption can cause some early symptoms, but they can be subtle.
Like what kinds of symptoms?
Well, you might have aruchi, which is a loss of taste,
Okay.
or shoka, which is swelling.
Hmm.
And then there's schwaz, or difficulty breathing,
Oh, wow.
and also krishanta, meaning you're getting thinner. And then, importantly, you have pandu, which is that paleness or anemia we talked about.
So these are like the first signs that something might be up.
Exactly. They're like the body's early warning signals.
Gotcha. So what happens as things get worse?
Well, in the later stages, which would be like CKD stages 3, 4, and 5, things get more serious.
Okay.
There's this thing called Dosha Dusha Samarchita.
Dosha what now?
It's a mouthful, right?
Yeah.
Basically, it means that toxins start building up and mixing together in the Medovaha Srotas.
Medovaha and Srotas.
Yep, the channels related to fat tissue and how your body uses energy.
Okay.
And here's the key thing. The mula, or root, of the Medovaha Srotas is the vrika,
Rika.
the kidneys.
Oh, so the kidneys are like the main source of the Medovaha and Srotas.
Exactly. And when that root gets damaged, you start seeing more obvious kidney-related symptoms.
Like what?
Well, there's atisrishmutra, which is when you're peeing a lot, like more than usual.
Hmm.
Then there's alpamutra, which is when you're not peeing enough.
Okay.
And bahalmutra, which is when there's protein in your urine.
Oh, wow. That's interesting how it all connects back to the kidneys.
Yeah, it's all linked.
In the article you shared, there's this table that
Mm.
connects modern causes of CKD to the different Srotas in Ayurveda.
Right.
Can you walk us through some of those connections?
Sure. So, like you said, obesity is a big risk factor for CKD,
Right.
and Ayurveda links that to the Medovaha Srotas.
Makes sense.
Since that Srotas is all about fat and how your body uses energy.
Yeah.
And then there are renovascular diseases.
Reno, what?
Renovascular diseases, they affect the blood vessels that go to your kidneys.
Ah, okay.
And Ayurveda connects those to both the Medovaha and Rasavaha Srotas.
So those channels are both involved.
Yeah, which shows how connected everything is.
Got it. What about some of the other causes of CKD?
Well, hypertension, which is high blood pressure, is another big one.
Yeah.
And Ayurveda says that's related to the Rasavaha and Raktavaha Srotas.
So high blood pressure messes with those channels.
Pretty much. It affects your circulation and how your body gets nourishment.
Makes sense.
Then there's glomerulonephritis.
Glomer, say what?
Glomerulonephritis. It's when the filters in your kidneys get inflamed.
Oh, okay.
And Ayurveda links that to the Mutravaha Srotas, which is specifically about your urinary system.
Gotcha. So each cause seems to have its own Srotas connection.
Exactly. And lastly, there are inflammatory diseases like vasculitis.
What's cheilitis?
It's when your blood vessels get inflamed.
Oh, okay.
And that's connected to the Raktavaha Srotas.
So it's amazing how these two totally different systems, like one ancient and one modern,
Yeah,
seem to agree on which parts of the body are involved.
that is pretty cool.
Now let's talk about what causes these problems in the first place.
Okay.
Does Ayurveda say anything about the Nidayan or causes of Vataj Pandu that matches up with what we know about CKD risk factors?
You know, there are actually some really interesting overlaps. Yeah. So the Ayurvedic texts list a bunch of things that can cause Vataj Pandu.
Like what?
Well, one thing is eating too much of certain kinds of foods.
Oh, like which ones?
Like foods that are really alkaline, sour, salty, hot, or penetrating.
Interesting.
They also say that eating foods that don't go well together or just eating unhealthy stuff can contribute to it.
Okay.
And then there's having too much of certain pulses and oils.
Okay.
And even stuff like sleeping too much during the day, exercising too much, or having too much sex.
Wow, that's a lot of stuff.
It is. And it's not just about diet and activity either. They also mention things like getting panchakarma, which is like a detox therapy done the wrong way, or not following the right routines for different seasons.
Okay.
And even holding back your natural urges is on the list.
Really? Wow, they really thought about everything.
Yeah, it's pretty comprehensive.
So how does all that ancient stuff connect to the risk factors for CKD that we know about today?
Well, there are some pretty clear connections.
Like,
Well, a lot of the risk factors for CKD are lifestyle disorders like diabetes, hypertension, and hypolipidemia.
right.
And those are all connected to things like diet and activity level, which Ayurveda also talks about.
Yeah.
Not exercising enough and being obese are also big risk factors for CKD.
Okay.
And then there are problems that you can be born with or that develop later, like having only one kidney,
Oh, wow.
or having polycystic kidney disease or kidney stones.
That's a lot. It seems like lifestyle is a big theme here.
It definitely is. And, you know, it's interesting that Ayurveda was talking about things like diet and sleep so long ago.
Yeah.
It makes you wonder if modern medicine might be missing something by not focusing more on those basic things, especially when it comes to preventing CKD.
That's a good point.
Ayurveda has this concept called Santarpanjanya Ahar.
Santarpanjanya Ahar.
It means eating too much rich, heavy food,
Oh, thanks.
like stuff that's sweet, oily, and sticky.
That sounds familiar.
Yeah, it's pretty much what we think of as a modern Western diet.
Right.
Lots of processed food, sugar, and unhealthy fats.
Yeah.
And we know that kind of diet can lead to all those lifestyle diseases that cause CKD.
Right.
And on top of that, Ayurveda talks about Medovaha and
Medovaha and
Yeah, it basically means your urinary channels are messed up.
Okay.
And they say that's a direct cause of Pandu and other similar problems.
Which makes sense, since CKD is all about the kidneys.
Exactly. So it seems like Ayurveda and modern medicine agree on both the parts of the body that are affected and the things that can cause these problems in the first place.
It's really amazing how much overlap there is.
It is.
So let's move on to the symptoms. You mentioned a table that compares the symptoms of Pandu to the symptoms of CKD.
Right.
Can you tell us a little more about those connections?
Sure. So, like you said, Alparakta in Pandu is
Yeah.
the same as anemia, which is super common in people with CKD.
Right.
And Alpameda, which is having less fat tissue, matches up with the unexplained weight loss that a lot of CKD patients experience.
Okay.
And then Nisar, that loss of weight and strength, points to the fact that CKD can really weaken your body and your immune system, especially in the later stages.
Yeah.
Shithalandriya, or weak senses, is kind of like the neurological problems that can happen with CKD because of electrolyte imbalances and toxins building up.
Wow.
And Vivarnia, that pale skin, is something you see in both conditions.
It's kind of freaky how well those descriptions match up.
Yeah, it is pretty striking.
What about the early symptoms of Pandu?
The Porvaroop.
Yeah, those. Do they match up with any early signs of CKD?
They do.
Yeah.
Yeah. Hridayaspandan, which is like heart palpitations, can be related to the heart problems that often come with CKD. Sweetapava or sweating too much might be because of electrolyte problems, which happen when your kidneys aren't working right.
Okay.
And Raukshya, that dry skin feeling, could be connected to the itchy, dry skin that a lot of CKD patients have because of waste building up in their bodies.
Wow.
And lastly, Shrama, feeling super tired and weak, is one of the main symptoms of CKD, especially as it gets worse.
It's so interesting how Ayurveda picked up on these things centuries ago.
Yeah, it is.
You know, we often brush those symptoms off as no big deal, but it sounds like Ayurveda knew they could be signs of something more serious.
Right.
You also mentioned some specific symptoms of Vataj Pandu that are linked to CKD symptoms.
Right.
Can you tell us a little more about those?
So there's Krishna Pandutva, which is when your skin is pale and dull looking and sometimes even has dark patches.
Okay.
You can see that in some people with CKD.
Good.
And then Riksha Anganam, which is just having dry skin all over your body, is another common symptom of CKD.
Okay.
Shath Parshwashwaruja is a long one, but it means having pain, numbness, and swelling in your feet and head.
Oof.
And that's similar to the nerve problems and swelling that can happen with CKD.
Right.
And then there's TODA, which is muscle spasms and tingling. That could be because of electrolyte problems and irritated nerves, which are both things that happen with CKD.
So even the really specific symptoms line up.
Yeah, it's pretty amazing.
Let's talk more about anemia, since that seems to be a big connection between these two conditions.
Okay.
You mentioned Raktavaha and Vataj Pandu.
Mm-hmm.
What's the link between that
Yeah.
and the anemia we see in CKD?
So in modern medicine, the main reason people with CKD get anemia is because their kidneys aren't making enough erythropoietin.
Or what now?
Erythropoietin, it's also called EPO. It's a hormone that your kidneys make, and it tells your bone marrow to make red blood cells.
Oh, okay.
But when your kidneys are damaged, they can't make enough EPO, so you end up with anemia.
Gotcha.
Plus, CKD can also make it harder for your body to absorb iron, which also contributes to anemia.
Interesting.
And the thing is, anemia usually gets worse as CKD progresses.
Mhm.
It usually becomes a real problem around stage 3 when your GFR, that filtration rate we talked about earlier, drops below a certain level.
No.
And it's like a vicious cycle. The worse your kidneys get, the worse your anemia gets.
Makes sense. So how does that compare to what Ayurveda says about Alparakta and Vataj Pandu?
Well, it's interesting that Ayurveda says Alparakta is an early symptom of Vataj Pandu, which means they saw this lack of blood as a fundamental sign that something was off in the body.
Okay.
And they said that if Pandu isn't addressed, it can spread to other parts of your body and affect your vital energy,
Oh, wow.
leading to Oja Kshaya, which is basically a loss of your life force and immunity.
That sounds pretty serious.
Yeah, it is. And that progression is kind of like what happens with CKD, where severe anemia and other complications can eventually lead to organ failure and even death.
Yeah, it's scary how those things can spiral out of control.
It is.
So to wrap things up, let's go back to the Medovaha Srotas and how it's connected to the kidneys.
Okay.
You said that alpameda, or losing fat, is a symptom of Vataj Pandu. What's the connection there?
Well, Alpameda points to the Medovaha Srotas being involved.
Right.
And remember how we talked about the mula, or root, of the Medovaha Srotas being the vrika?
Yeah, the kidneys.
Right. And that's super important because CKD is all about the kidneys being damaged.
Yeah.
So from the very beginning of CKD, the kidneys are losing their ability to work properly.
Yep.
And because they're the root of the Medovaha Srotas, that damage has a ripple effect throughout the whole body.
So it's like a domino effect.
Exactly. And that's why CKD can affect so many different parts of your body.
It's amazing how this ancient concept of Vataj Pandu lines up so well with what we know about CKD today.
It is.
We've seen parallels in the causes, the srotas that are involved, and the symptoms, especially anemia.
Yeah, it's pretty wild.
So I guess looking at CKD through this Ayurvedic lens could give us some new ideas about how to manage it.
Totally. I think focusing on the whole body and addressing the underlying imbalances like Ayurveda does could really help people with CKD feel better.
Yeah, that makes sense. It's more about improving quality of life than just treating the symptoms.
Exactly.
And as the article we've been talking about points out, even though these connections are really interesting, we need more research to prove that Vataj Pandu and CKD are definitely the same thing.
For sure. More research is always a good thing.
Absolutely. So this has been a fascinating deep dive, and it makes you think, what if we combined the wisdom of Ayurveda with modern medicine? Could we catch kidney problems earlier or even prevent them altogether?
It's definitely something to think about.
Food for thought, for sure.
Yeah.
Thanks for listening, everybody.
Thanks for having me.